So welcome everyone to this webinar on digital tools for school-based health and well-being education. The webinar is organized by the UNESCO Chair on Global Health and Education, together with the UNESCO Institute for Information Technologies and Education. And for this, it's part of a series. Actually, this is our second webinar. First one was on violence and was broadcasted in November. And now we have our second one on this particular topic. And we're happy that also UNESCO Regional Office of Southern Africa is involved in the organization. And we really have a great lineup of speakers to share with you in an interactive way the following questions. They will address the following questions: why health and education matters and why should it be part of the school curriculum? Why digital tools should be considered for school health promotion? What kind of digital solutions are there to support teachers and how can they then be used? And we'll share examples from different countries. It's a truly global topic and also a global presentation. And what are the practical considerations on using the digital tools in the classroom? As I said, we try to be as interactive as possible. So please use the chat and use for questions for the speakers, please use the Q&A, which is on the left bottom of your screen. For your information, the webinar is being recorded and also broadcasted via YouTube. I would like now to invite our speakers to introduce themselves to you. So, and each of the speakers will have 30 seconds to say a little bit about yourself. So first of all, I would like to introduce Mr. Professor Didier Jourdan, my dear colleague from France. And Didier, maybe you can introduce yourself briefly for this audience.
Thank you very much, Rolf. I'm more than happy to contribute to this webinar together with the IITE and the UNESCO teams at a global level. My name is Didier Jourdan, as you said. I'm the chairholder of the UNESCO Chair in Global Health of Education and also head of the WHO Center for Research in Health and Education. Over to you, Rolf.
Okay, which reminds me that my job is being the manager of the same UNESCO Chair Global Health and Education. Happy to do this work with you. Then the next speaker is Patricia Machawira from the UNESCO Regional Office from Southern Africa. Patricia, can you briefly introduce yourself, please?
Good afternoon, colleagues, and thank you so much, Chair, for the introduction. My name is Patricia Machawira. I'm the Regional Advisor for Education for Health and Wellbeing for UNESCO for East and Southern Africa region. So I sit in the Regional Office for Southern Africa of UNESCO in Harare. Thank you so much for the invitation.
Thank you. And Patricia, your colleague, Donald Tererai, could you also introduce yourself, Donald?
Sure. Thank you, Rolf. Greetings, everyone. My name is Don Tererai. I'm a project officer with the UNESCO Regional Office for Southern Africa. It is my pleasure to be here with you to share some of our work on digital comprehensive sexuality education in Eastern Southern Africa. Thank you. Over to you, Rolf.
Thank you, Donald. And next, I would love to introduce Tigran from UNESCO Institute. Tigran.
Yeah, thank you. I'm Tigran Ipoyan, Regional Health and Education Advisor, working with UNESCO Institute for Information Technologies and Education based in Moscow.
And we switch then to your colleague, Yekaterina Samolugo. Yekaterina.
Thank you very much. Hello, everyone. I'm Yekaterina Samoliga, working as a project coordinator at UNESCO Institute for Information technologies in education. I oversee diverse projects focusing on comprehensive health and education initiatives. And I also work on social media initiatives for parents, and I oversee artificial intelligence-based chatbots that I will be happy to present today. Thank you very much. Over to you.
Thank you, Katerina. And now it's my great honor and pleasure to invite Mr. Tao Zhan, who is director of the UNESCO Institute of Information Technologies in Education, with whom we organized this webinar. So the floor is yours, Mr. Tao Zhan. Then we'll hear Tao via the screen, via the voice of Tigran. Okay, please go ahead.
Thank you so much. I'm sorry for this technical problem. Dear colleagues and friends, greetings from UNESCO IDE in Moscow, and welcome you all to this webinar as one of the IDE webinar series 2024, co-organized with our partners. Last year, we launched the webinar series entitled Harnessing Technologies to Transform Education, supported by IIT's governing board members. This year, we continue. We are very grateful to Professor Didier Jordan and his colleague, Mr. Goff and Sylvia, for the great support in organizing this event. Professor Didier is UNESCO Chair in Global Health and Education, is also the head of WHO Collaborating Center for Research in Education and Health, and more importantly to us, is a member of IITE Governing Board. The board guides and supports IITE's program. We are very fortunate to have you, to have your guidance and support, dear Professor. As we all know that Africa is a global priority of UNESCO. We are particularly delighted today to have UNESCO colleagues from Africa. From Africa Harari office, Ms. Patricia and Mr. Rada. The office covering Southern Africa. They join us as a panelist. It's a great pleasure to work together with you. UNESCO IITE is a Category 1 Global Institute of UNESCO, committed to the inclusive and equitable digital transformation of education. Among other issues related to the development and promotion of information technologies for education in general, it is also mandated to promote and develop the digital information technology for education, for also for health and well-being in general, and especially in Eastern Europe and Central Asia. We have an innovative and passionate team led by Mr. Brown, who created the flagship activities of the Institute in promoting digital tools, including AI in health education. Because we are living in a world with full of new challenges and risks, even threats. We are living at a time everything goes digital. Today, when young people literally live in digital space, using digital tools for health education has become an imperative to engage with them, to provide accurate, relevant information, shape attitude and value that would help them today and tomorrow, working and living together for a better life and better world. IIT works with education stakeholders, civil societies, and youth organizations in the member states, experts and colleagues of UNESCO Health and Education section at its headquarters in Paris, with regional and country offices to develop, test, and promote different digital solutions to deliver quality and relevant education for health and well-being, and empower teachers to organize interesting and appealing lessons. IIT also supports and welcomes non-formal, informal health and well-being education, facilitated by community-based organizations, online youth media, delivered through dedicated websites, applications, and social media. Digital tools allow dissemination of health education to a broad audience at a low cost, overcoming geographic barriers. Digital tools are offering interactive and engaging formats to enhance the learning experience and encourage active participation. However, we also see different barriers for the delivery of so much needed health education, such as how to integrate digital into school curriculum, how to reach the unreached where internet connectivity is needed, especially in Africa, how to strengthen digital literacy and capacity building for teachers, and how to design gender responsive materials and approaches, and how to ensure safety and the security of personal data and healthy virtual environment. These are some of the key issues we are going to focus on today, guided and inspired by our distinguished experts and panelists. Let me finish by saying that I also like to thank my own team, IIT colleagues, the team of Tigran, who have managed to make everything ready for today's event webinar at the difficult time after the terror attack happened last Friday in Moscow. I'm very proud of that. Dear colleagues, your support and participation demonstrate our shared commitment to health and well-being for young generation, and our shared commitment to a better world and a better future with peace and prosperity. And with a very productive webinar today. Thank you so much.
Thank you very much, Mr. Tao Tsan. If there would be applause in the room, you would get a great warm applause with your very inspiring words and also setting the scene for our webinar. And I would like now to give the floor to Professor DJ Jourdan. Over to you, DJ.
Thank you very much, Director Tsan. Thank you very much, Ruf. I'm very happy to give you few ideas for this webinar. Please be aware that my mission is not to talk about digital tools. I refrain myself to talk about that because the distinguished speakers, we're going to speak after me, going to talk about that. My role is to set the scene of health and well-being education and the relationship between health and well-being education and the school curriculum. I just would like to share with you 5 simple key ideas that will help, again, to set the scene and to put in perspective the different contributions of the speakers that are much important on mine because they are really focused on the digital resources we have for health and education. So my 5 ideas are very simple. First of all, why do we take into account health in the school dynamic? The second is, why do we have to have a global perspective? And that's why it's so important to have colleagues from all the continents here as speakers as well as participants. Then I will give you a few ideas about the way in which we could shape the content of the health education curriculum. And then the 2 last parts of my talk, the ideas 4 and 5, are about how to do it. Because it's not only a question of having a good idea. The question is, how could we help every schools on the planet to take health into account, to take well-being into account in order to improve health education and health achievement. So first idea, all of you know that the health and education are inextricably linked through one thing. First of all, because you need health to be able to learn, and education is a key component of health. And we always need to think through the point of view of the health sector and from the point of view of the education sector when we want to talk about school health promotion and school health education. From the health sector, what's important, this is the iceberg. Why the iceberg? Just because you know the iceberg, you can see only 10% on the surface. the most important of the iceberg is not visible. And it's the same for determinants of health. When we talk about health, we think hospitals, we think doctors, healthcare setting, but you all know that more than 80% of the determinants of health are linked to biological, socio-cultural, environmental, behavioral, education factors, and all of these are linked to education. So from a public health point of view, it's absolutely critical. That's a priority. Never forget that 20% of the global population is in schools every single day. Of course, from an educational point of view, this question is different. It's about, first of all, creating the condition for educational success, because you need to be healthy and to live in a supportive environment to be able to achieve in the field of education. And it's also because health education is an essential part of culture that is handed down from generation to generation in all civilization. So you can see that there's a kind of common interest in having strong school health education policies, because it's really part of what could help cities, countries, territories to be healthy and resilient. And then that's why we really needed to focus on what makes possible the commitment of schools to health and well-being. This is all the more important as you all say that in terms of health, our world is really inequitable. It is true between countries, but it's also true within countries. And yeah, you have this classical figure from Michael Marmot showing that the life expectancy is extremely different depending on the social background of the people. And why do we need to strengthen health education and promotion in schools? Because this is one of the best way to contribute to reduce health inequalities and to remove most of the obstacles for people to be healthy. I'm just not saying that from my point of view. This is based on the review that we made within the UNESCO chair, and that shows that universal approaches, it means approaches that targets all the kids in school, and also targeted approaches that are more focused on the children and young people in vulnerable situations, both of them are clearly efficient and effective. This is absolutely critical to remind that health education and health promotion in schools works. But more than that, when you work about this kind of programs from an economic perspective, data showed clearly that the return on investment of the school health promotion and education programs are high. It means they are really cost effective. So it's not only about, building the competencies of the population, which is critical, but it's about reducing inequalities and doing so in a way that is cost effective for the cities, the territories, and the countries. What we know from research, and probably most of you know, is that for that kind of programs to work, you need to take together the school health promotion policy, the school climate, the environment, the relationship with the community, the link with the healthcare sector, and of course, the school curriculum. It was my first idea. The second idea is that we must speak from a global point of view. We must work together. You remember when you were young, the planet was very big, but now we all know that in fact, it is very small. And we are more and more aware of the importance of the interactions between all of us and also with all the living beings. And this is true that now most of the determinants of health are common to all of us, from east to west, from north to south. So adopting a global perspective when we think about health education and health promotion in schools is absolutely critical and needed for the next years. It has to help her to stop thinking, from our own perspective. You all know this metaphor, this story about the gentleman who lost his keys in the street, and he was just trying to find his keys under the street light, not because he lost the keys on the street light, but because there's light here and it's easier to search. We need to move from that perspective, which is really limited to very few sources of data, to a global perspective, because now more and more we have a lot of lessons that we can learn from, solutions created in the different countries, in the south, in the north, in the west, and in the east, not only evidence-based practices, but practice-based evidence. And this is, for me and for the UNESCO chair, and also for the IIT, as Director Sanchez said, it's absolutely critical to move from a very limited and narrow perspective to a global one. This is my second idea. The third idea is about the content and the fact that children and young people learn about health in different settings. Of course, in schools, but also in after-school programs, in all kind of municipal different settings, museum, libraries. They also learn within the healthcare system. When you meet a nurse, a pharmacist, or a doctor, you learn about your health. But it's also the case in faith communities, associations, and finally, because this is absolutely major, from the family and the mass media, the social networks, and the media on demand. What does it mean? It means that if we want to think about an efficient way of promoting the health of children and young people, we need to think about the school setting, but also the school setting link to the entire environment, the ecosystem of life of children and young people. And probably Tigran gonna use this slide later during this webinar. But never forget that the sources of information about sexuality and reproductive health are, first of all, friends and peers, the digital spaces, and then schools. And we need to mobilize these three different sources of information to contribute to the health of children and young people, knowing that 93% of them, and this is the work of the UNESCO IITE, regularly search data about bodies, sex, and relationship in social media. So what we need to do all together is to think from the perspective of the children and young people, with clearly the school at the very center of the ecosystem of life of children and young people, but connected to the entire, I would say, ecosystem of life of the children and young people. What to learn? What content for health education? Just in few words, because we'll talk about that later. It's always to think from the personal and the individual perspective and the collective perspective. That's why we always talk about health literacy. What could I do to protect and promote my own health, but also citizenship for health, meaning how could I contribute to the decisions about health as a citizen? These two elements are the two components of health education, and this is what we want to promote. And there's, at the global level, different tools to help cities, territories, countries to build the health education curriculum. This is the global standards of WHO and UNESCO. There's also examples in many countries, in all of our countries. This one is the health education standards in the USA, with, on the one hand, the themes, the concept, the facts, and on the other hand, the health skills. Most of the curriculum are based on that. In general, what we all have to have in mind is that to have healthy citizens, We need to help them to build core competencies, of course, languages, mathematics, to have cross-curricular and transversal skills that are the classical communication skills, emotional skills, and all the decision-making skills, and to have competencies related to different themes that could be addiction, sexuality, and reproduction. This is clearly where we are. Of course, that's a complex domain, but it is absolutely major. Knowing that kids learn from different settings, family, clubs, association, and schools, we need to try to create a coherence, to put together these different contributions through what we call a health learning pathway that could generate around the kids, different kinds of educational intervention that will help them to learn about their health through the different settings. And of course, it's all over the life, and especially when kids are young. To do that, we have to have in mind that the key question is not only to implement key programs. It's first of all to close our mouth and open our ears, and to value what already exists in schools and in the community, to share it, to align it, and to improve it. To finish my talk, I would like now to move to how could we move together. And we really know now from research that the key issue is not to implement new curriculum or new school health program. It's more to contribute it to orienting and supporting social change. And as the cartoon, so that of course it's difficult. It's difficult for many reasons. And the first one is that it's hard for people to change their practices. But if we want to move forward, research shows that solutionism, we have the perfect intervention on sex and relationship education, and we just have to implement it. It doesn't work. What works is to contribute to increase the motivation and the agency of all the people involved in the health, education, and promotion of children and young people, school staff, health professionals, activists, unionist policymakers. The two key words are motivation and agency. This is what we have to take into account. Of course, one of the key difficulty is that the teachers, especially just like this gentleman, are, overwhelmed by the different tasks and the pressure. So if we want to add one box on this bicycle, the gentleman gonna fall. We cannot do that. If we want to move together, I think we are talking about change, process of change, we need to show that health education and promotion contribute to create coherence within the professional activity of the teachers and whole school staff, and then to help them to work on their professional identity and then include health and well-being within this professional identity through in-service and pre-service training. The key element is that it's a question of coherence. And then instead of having a millefeuille of different competencies and requests to the teachers, our main role in our field is to help them to make a mayonnaise, putting together in a coherent way all the different tasks of the teacher. What is true for the teachers is also true for the healthcare professionals who have a very important role in the health of children and young people. To finish my talk with the last idea I would like to share with you is that how could we do that? How could we contribute to build agency and motivation through the people? To do that, we have some barriers, but also some levels. The first level is the creation of the condition for intersectoral work, education, and health. Among the levers, this is supporting schools concretely where they are in doing a better job. This is also supporting associations, municipalities, sports club around the school to contribute to the health and young people, and also to contribute to the mobilization of the healthcare and social professionals around school. This is what could contribute to change in favor of health for children and young people. To do that, we need to create what we call ecosystems for knowledge production and sharing, put together people who are involved in the field, it's practitioners, policymakers, researchers, together, to work together in order not to implement the best intervention in the world, but to improve the quality of the environment and the services in schools rather than implementing ready-made universal solutions. This is what we could do, knowing that you cannot create health without the people themselves. It means the staff and also the children and the young people. So my 5 ideas were, first of all, how we could contribute to integrate health and education in the curriculum. The second is about the fact that we need to be global. The third is about learning for health. The fourth is about orienting the social change toward supporting the schools to take health into account. And finally, the need to build ecosystems of knowledge production and sharing together to the professionals. What we're going to talk now is about, the digital dimension of education, which is, as Director Tsad said, a key part of education now. But even if it's digital, even if it's face-to-face, we cannot contribute to health and well-being in schools without the people themselves. Nothing about them without them. This is the key word. We need to work with school staff, parents, families, children and young people to move forward in the field of health and well-being education in schools. Thank you very much. Over to you, Rolf.
Thank you very much, DJ, and I see the applause on the screen and maybe also from the audience. Thank you very much for this brilliant overview and stressing where we are and where we are heading for. Some people asked if the PowerPoints will be available. Yes, there will be. We will put them on our dedicated website. And there was also very lively communication during your talk, DJ. And maybe Sylvia, you can mention one of the Q&As that was on the way, and maybe DJ, you can give your point of view on that. Sylvia? Yes. Sylvia, by the way, is our dear esteemed colleague from UNESCO, Chair Global Health and Education, and is the brains behind facilitating and organizing all this. Over to you, Sylvia.
Thank you, Rolf. Yes, Blessing Sally Erumli, she mentioned that the main challenge in her community is finance, money, and manpower. Do you have any advice for her, DJ?
This is, of course, a major issue because the question is about the way in which we are funding education. Of course, there's no magic wand, but what we observe in many countries is that we can do and better use of the means we have. And then there's 2 different dimensions. First one is advocacy to contribute to fundraise for the health education initiatives and for education in general, first thing. And the second thing is to try to make the best use of the money we have through capacity building of school staff and also through this link between school and the community. Every community on the world have assets, have capacities to contribute to the education of children and young people. Advocacy, making the best use of what we have by creating intersectoral connection in order to improve the efficiency of the health education and health promotion policies.
Thank you, DJ, for your reply. And I think we should, given the time, go to the next speaker, but you will be here with us for the rest of the talk. So there might be a point that you could also chip in to contribute to the discussion. And now,
Absolutely. Thank you very much.
Thank you, DJ. And I would like now to invite Tigran Yekoyan and Ekaterina Samoligo to tell us how and why digital tools can and should be used to support school-based health education. And you will also, told me, share some examples from different countries. So over to you, Tigran and Yekaterina.
Thank you very much. I really can't thank Professor Didier enough for this enlightening presentation and very appealing speech that underscores and explains the importance of health education. And one of the questions which I noticed in the Q&A section was that students do not register to health education. What can be done about it? And I want to start with this. Health is not an actual issue when you're 10 years old, 15 years old. You feel quite healthy and no any problems, aches, etc. Well, of course, some people may have health conditions and issues from early on, but in general, for teenagers whom we're talking about mostly, is not an issue. And that's why health education per se will probably not sound very appealing to them. So you would just call it relationships education, education about growing up, relationships, well-being, skills, social and personal skills building education, etc., that may attract more students to register and participate. And this is not just about changing the title, but about the comprehensive content that such education encompasses. Over the last decades, health education has very much changed, developed. It has become more holistic and comprehensive. I remember the years when it was predominantly about HIV, when the epidemic first erupted. But over the past few decades, many more resources have been created, both for classroom-based instruction and also digital, for students, for teachers, for adults, parents, anyone to learn about body, reproductive health, relationships, etc. Digital tools seem to be really cost-effective when we need to reach out to big numbers of educators, to train them, to deliver health education and support them throughout the journey to truly comprehensive, engaging, inspiring, and making lifelong impact health and relationships education. It is not always easy for a teacher to become such inspirer in a classroom without having other tools like visual aids and other to support and complement what they discuss in the classroom. We all remember the time when schools closed because of COVID-19 pandemic, and how education massively resorted to online teaching and learning in contexts where internet and gadgets were more or less available. In general, at that time, health education was not high on the agenda because schools were grappling with the need to deliver core subjects. And along with that, to teach kids and adolescents to wash their hands and maintain social distancing. Nevertheless, at that time, we have seen emergence of some digital tools that provide education on puberty, reproductive health, family planning, and also what was really important, online counseling on these issues to adolescents locked at their homes. And that was really, really very good opportunity for us to negotiate with the Ministry of Education of Kyrgyzstan to develop a suite of videos, 24 videos, on a range of topics to demonstrate and discuss remotely and now in the classroom during obligatory homeroom health education classes. To help teachers organize the lessons, we also put together a manual with 24 scripted lesson plans. They started using them when schools were still closed, but keep using them until now. And realize how useful they are, how impactful they are, how easy they make the task for teacher to get prepared for the lesson and run it. These videos can be used for so-called flipped format. When internet is not easily accessible at a school, kids can watch the videos at home or from their homes and then spend the time in the classroom for reflection, discussion, role playing, brainstorming, developing, training some skills, etc. And with over 65,000 views, and I believe that many of them are collective views, when a whole classroom watch the video from one gadget, these video lessons are in demand among students. They find the lessons augmented with the watching and discussion of such videos more interesting, more engaging, and better explaining complex things. This is direct feedback, well documented in many places of the country. And teachers also like these videos as they are ready tools and they don't need to look for any other resources. Just follow the manual, watch the video before the lesson, and then show it piece by piece and allow enough time for discussion with the students. This encouraging feedback from Kyrgyzstan inspired us to create 2 more suites of videos for Kazakhstan and for Belarus. We're just starting this project in Belarus. The videos are ready, and we'll be training school teachers and also teacher educators to advance with health education supported by such internet-based tools, because all these videos are available in YouTube. Greater integration of digital tools into teaching has several obvious benefits. This is our major learning from this over 2-year project. First, we can ensure accurate, age-appropriate, and bias-free content to be delivered in an engaging manner to inform teenagers, trigger reflection and discussion. This is really important, as we not always can ensure that teachers are very well prepared and convey the right messages, free from their personal biases, learning, life experiences, etc. This is also very useful tool when and where teacher preparation and the quality of their teaching is a little bit an issue, where biases are deeply rooted, and we see how teachers struggle to say something which is advised in the evidence-informed curricula, but which contradicts to their own personal life story, and where teachers feel uncomfortable to discuss certain topics. And I have to say that our recent study in Armenia proved that students themselves prefer outside adults to come and talk about reproductive health and sexuality rather than their regular teachers. They feel more comfortable to discuss these issues with someone else. And the video kind of helps to make this distance, make not that personal when you discuss it immediately with your homeroom teacher, for example. Digital tools also provide safe and comfortable space for learners. Online Q&As, quizzes, tests with correct answers, search for information and self-assessment, as learners feel safer to look for what they want to learn and to check their knowledge without fear of being teased or ridiculed by peer. They can do it in the classroom using their phones, or they can do it at home using platforms with different gamified tools. A study in the United Kingdom, and you see here the screenshots of 2 resources developed in UK, proved that using a digital game to support relationships and sexuality education has led to increased discussion and debate among learners and improved their ability to recognize and prevent sexual coercion, which is really a big issue for teenagers and older young people. But no matter what wonderful tools we have, how many gadgets and how speed the internet connection is, Teachers are very, very important more than ever. They are those who create safe space in the classroom, make sure that kids feel comfortable to ask questions, to discuss them, and not to tease each other, and that teachers refrain from any kind of teasing or bullying while discussing such sensitive issues. And these are teachers to ensure inclusiveness and content adaptation, to take into account the needs of different learners, for example, learners coming from migrant families, children having some forms of disabilities or special needs. And teachers are those who can carefully select those digital, non-digital tools which would be appropriate for their students. And they can offer them also different social media communities, articles in the media, chatbots, other tools to complement what has been designed specifically for school. And my colleague Katya will tell more about such digital solutions developed not specifically for school, but which can be used or at least recommended by teachers to their students. And of course, teachers can play an important role to help their learners navigate digital spaces safely, accurately, and find accurate and trustworthy information. To use digital tools in the classroom, we first need to have them, and ideally they are developed with participation of young people themselves and educators. It's absolutely critical that they are relevant to what learners need themselves, not just adults things they should know. And they have to be aligned with the school curriculum. Look at different subjects, extracurricular activities where they can be used, and ideally they are endorsed by relevant bodies. Teachers, school administrators feel much more comfortable while using endorsed resources. And when we develop such resources, we of course should take account into connectivity and gadgets availability. And thank you, Tao, for mentioning it in your speech. To help teachers use them, we first have to inform about availability of such resources. Then teachers have to like them. And if the resource is not attractive, they won't. If the resource is difficult to use, they won't. But even if it is very simple to use, still we have to help teachers learn how to use these resources, and it takes time. Digital literacy is an issue for teachers and also for learners in some contexts. And of course, teachers have to be empowered to engage with parents, respond to their queries, fears, resistance, especially when it comes to talking about reproductive health, sexual relationships, and other issues. And to help teachers in these areas, we have put together a digital platform, a learning hub. We called it EduHub. It's for Eastern Europe and Central Asian countries, for educators, school counselors, psychologists, youth workers, and every year over 10,000 people come and participate in our webinars, benefit from self-study and facilitated courses and resources available there. And to conclude, I want to thank our colleagues in the health and education sector in UNESCO headquarters, who have put together this technical brief using digital tools to support classroom-based sexuality education. It's really interesting, short reading, which provides good insights into why such resources are important, how we can use them, and provides also examples of good practice. Thank you very much.
Thank you, Tigran. And my question to you, Tigran, is how can you be sure that teachers can make the right choice to go to your well-developed and well-informed material when they have to search on the internet, especially on these kind of topics?
Well, this is a matter of selling, actually. Selling in the broad and good sense. We don't want to impose anything. but we make sure that these resources are carefully developed. These resources are endorsed by relevant bodies. And then we start training teachers, show them the resources, provide them series of webinars to help them dive into complex topics to discuss and demonstrate these videos, tell them how to use them to organize the classroom teaching and learning. And quite often they use them. Sometimes they go much beyond and then do a role play with their students, shoot it on video and send to us. I was really impressed how they did it on forced marriages, a big issue in some countries.
Certainly.
And this is really very rewarding. In some cases, teachers go and use kind of traditional things like many PowerPoint presentations available in the internet. Not always they are of good quality, but whatever they choose.
Yeah. Okay. Thank you. Thank you very much for your answer. And I'd like to move now to your colleague, Katerina, please. The floor is yours, Katerina.
Thank you so much, Ruth. Thank you, Tigran, for the introduction. So once again, as I said, linking with school-based health education, we have to acknowledge that not every student feels confident and comfortable raising sensitive questions in a classroom setting. And this highlights the significance of providing adolescents with avenues to access sensitive information discreetly and anonymously. And that's where digital tools step in. With the introduction of SPAN and law chatbots, UNESCO ensures that adolescents can discreetly access critical information, and this empowers them to navigate into important topics like sexuality education, reproductive health, and gender equality confidently, regardless of any reservations they might have about discussing these issues openly in a classroom. So let's dive deeper into the remarkable journey of SPAN and law chatbots. These chatbots, fluent in Russian, Kazakh, and Kyrgyz languages, have processed over 250,000 messages each to date, providing invaluable guidance to adolescents to explore sensitive topics. And SPAN and law are more than just digital assistants; they are like trusted allies, offering evidence-based advice on all things relationships, health, psychology, and more. And behind the scenes, we have a team of experts, psychologists, medical professionals, and legal experts who ensure that the accuracy and empathy of SPAN and law is ensured, and from providing medical advice to debunking myths, these experts collaborate to empower teens with reliable information. So on the screen, you can see one of the prompts that user can ask our chatbots, and you can see that we have programmed our chatbots that they answer all the questions and queries in a very friendly and empathetic way. But let's dive deeper into the technical wizardry behind the scenes. SPAN and law use a very sophisticated high-level classification system represented by colorful blocks you may see on the screen. So when you send a message, it's quickly categorized into one of three types. So messages involving such sensitive and provocative topics like bullying, for example, they are flagged in red, prompting a neutral response crafted with our experts' advice and guidance. Then general inquiries are handled by the blue block. So creating the small talk answers first and then diving deeper into the topics of our interest. And it ensures that the chatbots steer clear from irrelevant or inappropriate topics. But what about those complex questions that need and require more than a canned response? This is where our triple augmented generation technology comes into play. This advanced algorithmic framework allows SPAN and law to synthesize responses by augmenting information retrieval with advanced generation capabilities. So you might think of it as a digital librarian who tries to search our knowledge base for the perfect answer tailored to your query. And don't worry about your privacy at this point, because the boards anonymize and analyze conversations, ensuring that your secrets stay safe. So in conclusion, I would say that SPAN and OILO aren't just chatbots, they are digital guardians, assistants guiding teams through their waters of adolescence with wisdom and compassion. And by harnessing the power of artificial intelligence and encryption technology, UNESCO is not just keeping up with the times, it tries to shape the future of teen health and well-being. In a nutshell, this is how our amazing chatbots operate. Thank you very much, and I would be happy to answer to your questions concerning the remarkable chatbots we have developed with our technical specialists and a talented team of psychologists, medical experts, and legal experts. Thank you.
Thank you so much, Yekaterina, for your great talk and specifying on the chatbot options. It's all very new to me. Also, it might be my generation, but using this new technology is really promising. And let's see, Sylvia, are there any particular questions in our Q&A that you could maybe share with Tigran and Yekaterina for them to answer, please?
Yes, thank you. There's a question, actually, Tigran answered it, but I think it's relevant for all of us. It's a question from Denise Froman from UNICEF. And they've seen many countries where teachers feel overwhelmed with the many responsibilities that their job encompasses, including teaching the curricula, providing health and nutrition education, administrating supplementaries, etc. And they see that many countries switch to the health sector or community-based platforms for health and nutrition education. And her question was if the colleagues at UNESCO experienced the same.
I think so, and I already tried to type my reply that I believe it's universal in many countries. And every day we come to school with a new topic, a new issue, green education, environmental education, etc., etc. And every time I myself hear this new title, I get scared. So we have to be careful to say that this is not a new subject. This is not a whole new activity you have to begin from the scratch. So you can either integrate into your regular classes, and it's not that difficult. And the best thing is to provide ready-made, simple tools to use, because really people have no time to devise their own lesson plans, etc., etc., especially when they are overwhelmed with multiple tasks.
Thank you. Okay, were there any other questions, Sylvia, or you have a short one?
Yes.
Yes, I thought so.
Question for Ekaterina. Is the UNESCO chatbot, is it available for all countries or only for specific ones at the moment?
Thank you so much for a question. It's really a good one. As I said, currently the chatbots are developed in 3 languages, so Russian, Kazakh, and Kyrgyz languages, because they were tailored to these specific countries. But in future, I hope we'll have all the opportunities to expand our geography, and we'll try to go beyond even our region. And of course, we'd like to offer all these amazing opportunities that chatbots present to a wide audience. And by the way, if you have any questions concerning the technical specificities, please do write me on the email I've previously shared. I would like to link you with our technical specialists who will present all the technical wizardry even better than I do. And of course, I'm open to all the questions concerning the content side of this amazing initiative. Thank you.
Okay, thank you. Thank you very much for this very interesting and innovative tool that you have developed and are actually using. So chapeau for this great initiative. So now
Thank you so much.
I would like to introduce our next speakers. Mrs. Patricia Machavira and Mr. Donald Tererai, who bring forth the wealth of experience from East and Southern Africa. They will both enlighten us on the strategic development and deployment of digital tools to bridge the gap in comprehensive sexuality education for adolescents and young people in the region. They will both elaborate on the intricacies of implementing comprehensive teacher training programs alongside the direct dissemination of knowledge to students. And through a combination of low and high technical digital solutions, they have effectively addressed the diverse needs of learners, ensuring access to age-appropriate and high-quality CSE materials. So over to you, Patricia and Donald.
Yes, thank you so much, Don and I will be talking about enhancing health and well-being of adolescents and young people in East and Southern Africa through the work that we are doing with the program, Our Rights, Our Lives, Our Future. So I'll start off with the early slides and then my colleague Don will finish off the presentation. So the work that I'm talking about falls within a large program, Our Rights, Our Lives, Our Future, which focuses on supporting member states to scale up comprehensive sexuality education and school violence prevention in basic education. I think at this point, it's important to note that we have an addition for higher and tertiary education institutions, which is called Our Rights, Our Lives, Our Future Plus. So this does more or less the same work, but in universities, technical and vocational training colleges, and also polytechnics. So the O3 program has a vision of ensuring that children, adolescents, and young people in sub-Saharan Africa are healthy, educated, and empowered to thrive. I think we had, a good presentation and justification of the intricate link between health and education and why it's important to support this work around school health. The O3 program aims to reduce new HIV infections, early and unintended pregnancy, gender-based violence, and child marriage, and also to increase school completion rates. For us in East and Southern Africa region, you may be aware that we are the region which suffered quite extensively from high HIV infection rates. We still do, and our adolescent girls and young women in the region are still very much affected, and early and unintended pregnancy also results in young people not being able to continue with their education. So the program, Our Rights, Our Lives, Our Future for basic education is running in 35 countries across East and Southern Africa and West and Central Africa. We anticipate to have reached about almost 40 million learners by the end of 2027, which is the 4-year period of implementation, over 200,000 schools, and over 500,000 teachers in both pre-service and in-service, and 50 million stakeholders. These are your community members, family members, guardians, religious, traditional, and community leaders. So the map on the left just shows you the countries that are involved. It's being supported through the O3 program. So the O3 program was conceived as mainly a school-based program, capitalizing on the fairly high enrollment rates that school enrollment rates that we have in East and Southern Africa, but also building on a legacy of HIV prevention curricula, which started as far back as the early 90s. So it is the space in the curriculum that has evolved from focusing on HIV prevention mainly to broadening to include comprehensive sexuality education, school violence prevention, and other sexual and reproductive health issues within the curriculum. So the O3 program has those 5 objectives. The first one focusing on supporting and enabling policy and institutional environment. Sorry, Don. And then, so for this presentation, we'll focus mainly on the 2 objectives. The first one being to support countries to scale up and strengthen the delivery of accurate, rights-based, gender transformative, and good quality teaching and learning on CSE and school violence prevention. So this objective speaks to the work that we do do on training teachers around good quality CSE and school violence prevention. And objective 3 speaks to the work that we do reaching young people directly with information to enable them to respect their right to make decisions and drive change in their lives. And then the 4th objective speaks to the promotion and creation of safer, inclusive school environments. And the last one is, evidence generated from monitoring, evaluation, and research and learning. So for the purposes of this presentation, we'll focus on how we've used digital tools, particularly in those 2 objectives that we're showing there. So, as I mentioned, I think our work has been mainly school-based, but since as far back as 2015, 2016, we've always had local concerns around, and sensitivities around delivering comprehensive sexuality education. So there were concerns from local traditional and religious leader groups on the content, what is the content that you're providing as part of comprehensive sexuality education? And is it appropriate for the younger learners? So there have been local concerns, but from as far back as 2016, we started seeing a pattern and an escalation of this controversy, and realized that this was now coming from international forces, particularly conservative right-wing groups from the US, with Family Watch International in particular leading a coordinated opposition against comprehensive sexuality education. So these are, the tactics that we saw in the patterns of opposition. So disinformation, using multimedia platforms, and targeting key leaders in ministries of education, and the timing of the opposition usually intensified during a time of key milestones. So for example, around the time where we're launching the ESA ministerial commitment or the WCA commitment. So what is the significance of this? It is that in a number of countries, we were not able to advance with provision of comprehensive sexuality education through the school system, because the opposition was able to penetrate the WhatsApp groups, for example, of senior policymakers in countries like Ethiopia, and there was a pushback from government on the delivery of comprehensive sexuality education, and also in countries like Kenya. So this intensified. And then we also saw the coming of COVID, which made us look at, so how in those countries which had been affected by opposition, how are we now able to reach young people who we otherwise can't reach through the school system? You can move to the next slide, Don. Next slide, please. So, sorry, can you confirm me? Okay, thank you. My slides were not moving. So in this presentation, we will talk about how we've been able to reach young people, adolescents and young people via trained and resourced teachers in the first section, and then Dawn will pick up and speak to the efforts that we've used in the O3 program to reach young people directly. So one of the ways that we've used to reach young people through training of teachers is through the development of the CSE online course. So for the O3 program, teacher training was a huge resource. So what we did in developing the CSE online course was we wanted to be able to reach large numbers of teachers, but also at a reduced cost, because reaching the complete teacher training course on CSE would require that you bring teachers to one location for 5 days, and it was usually quite expensive. And that became a huge expense, especially given the size of the O3 program. So we developed this online CSE course for teachers, and the content of the course, I think you can see there on the right, the learning units that are covered by the course. So participants have access to this material, which covers 10 learning units on CSE content, as well as classroom management and CSE delivery best practices. So since 2015, you can move to the next slide. Since 2015, when the course was developed, we've been able to train 10,485 teachers across 18 countries. And the course is currently available in English and Portuguese. It's a self-guided course. It can be accessed on any device, and teachers study at their own pace anytime. It has tests, to test your learning, and also quizzes, and also some learning activities, valuable discussions and feedback, and teachers are able to earn a certificate after completing the course. So the teachers who have been trained are automatically integrated into a community of practice to allow them to remain connected. And this community of practice is also a platform to allow teachers to share knowledge and experiences. Because what we realized is, after going through this online course, or even any teacher training, that's not enough for a teacher. You need to be constantly connected so that you have a forum where you can ask questions, where you can find out how other teachers are dealing, for example, with sensitive topics. So we have the Connect and Learn community of practice, not only for those who have been trained using the online course, but even those that we are training using the face-to-face methods, either in pre-service and also for in-service. So this Connect and Learn is a community of practice, which is connecting teachers and other stakeholders in a platform where they can share knowledge and experiences. And then it is complemented by a mentoring and support supervision program, which includes activities such as thematic workshops and webinars for teachers on subjects where teachers require more information. For example, how to deliver CSE to learners with disability. We've had a webinar on that, and a number of other topics, a number of other selected topics. So the teachers, again, who are part of the community of practice, have access to the O3 digital library, where they can access UNESCO-created digital CSE resources, and they also get links to global resource libraries, such as the Amaze videos, which they can use as tools to supplement their teaching in class. So one of the plans that we have on the horizon for 2024 is to develop a lesson plan generator, which is artificial intelligence powered. Teachers will input lesson parameters and guidelines in the tool and get recommended lesson plans based on approved UNESCO international technical guidance. I think a lesson that we've learned, and I think Tigran, you mentioned this as well, is that scripted lesson plans are quite popular for teachers because they really provide teachers with that guidance. And where teachers have not been trained or are not feeling comfortable to develop lesson plans, then they can get that support, especially for us where in a number of countries, CSE is not taught as a standalone subject, but integrated across a number of subject areas, which means that more teachers are needed to be able to support the delivery. So the AI lesson planner for teachers automates the foundations for lesson planning, and through that, teachers have instant access to structured lesson blueprints, which are tailored to specific topics, thereby helping them with the lesson preparation while ensuring that we are comprehensively covering the curriculum and making the teaching approach both efficient and effective. So I'll hand over now to my colleague, Dawn, to talk about how we've been reaching adolescents and young people directly through digital and low-tech learning experience.
Thank you so much, Patricia, for setting that scene. I'll be looking at how we reach young people directly through digital and low-tech learning experiences. So just to give a background on this, the O3 program recognizes the diverse needs and circumstances of adolescents and young people, including those who are out of school or hard to reach. I think Patricia provided this background very well when she mentioned that in some countries, it's difficult to reach young people that are in school. So to effectively engage these groups, the program really employs a multimodal digital approach to deliver CSE programs. And our approach is guided by what we call the O3 Digital CSE framework. And it integrates three critical elements, the first one being content, the second one being digital tools, and the third one being the engagement strategies that we use. So where these three intersect, we'll find content that is scientifically accurate, is culturally sensitive and age appropriate. And we use various digital platforms and technologies. These include mobile applications, chatbots, radio, television, social media, and so on to disseminate the content. Then the final part is the pedagogy. So we employ engaging pedagogy approaches, interactive strategies, and learning activities to foster knowledge acquisition, skills development, all aiming for positive behavior change that can lead to positive health outcomes for young people. Now, in implementing these digital solution, our guiding principle really is to use the technologies that the young people already have access to and know how to use. So we prioritize the most widely used devices and platforms so that we ensure that no young person is left behind, regardless of their digital access or circumstances. So what we have done is we've identified 3 levels of digital access in East and Southern Africa. These are namely high tech, tech, which you can call medium tech if you want, and then low tech. So we still find in East and Southern Africa that there's a very big digital divide between those who have the technologies and those who don't have the technologies. So we deliberately plan for all young people. So in low tech, we've got young people who lack access to digital devices and digital connectivity. They may have basic feature phones, not smartphones. They do not have 3G or broadband. You could find they've got maybe GSM technology allowing for SMS. And for these young people, usually would use tools like radio, through radio lessons, through radio drama series, and television as well. You see there are also some innovations that are in red that we are still working on and will be bringing out soon. And in medium tech, we find young people who have got limited mobile phone or computer access, and have got limited 3G or 4G, which is sometimes poor or unstable or unreliable. And still across the continent, broadband is still very, very expensive. Then we also find that these young people may not always have a device, as they may be sharing it with others. We found out when we were launching WhatsApp chatbots that many young people were actually using the smartphones from their parents and from their guardians. So for this medium tech, we've got innovations such as WhatsApp chatbots, mobile applications, and social media. Then we've got the high tech. The high tech, these are young people who have good access to a range of digital devices with good quality and fast connectivity at all times. This is very, very rare in the region, but we find the young people who have got access like to use responsive resource websites, which give them CSE content. We also have podcasts, and we will be launching some micro-learning courses soon through some mobile applications. And one of the areas that we are also conceptualizing on is on online safety, with the realization, of course, that being on the internet, the young people would need to be safe. So I'm going to expand on one example from each of these 3 categories, starting by how we've been using WhatsApp to support learning. So through the O3 project, we developed the Zizo Paden and Kupunzira Paden. This basically means learn from home or learn remotely. These are automated chatbots that operate on WhatsApp. And WhatsApp is one of the most commonly used applications in East and Southern Africa. It's a low data messaging platform with an intuitive interface. I think almost everyone has used WhatsApp by this point, and it makes it a very ideal tool for reaching young people. So to leverage on this popular platform, we developed the chatbots on WhatsApp and they provide CSE resources to students across Zimbabwe and Malawi. While the primary focus for these chatbots is on guidance and counseling curriculum in Zimbabwe, for example, and life skills education curriculum in Malawi, they also offer resources on other non-CSE related learning areas. We found that this can be a strategy that offers more value to the students and also brings more students onto the platforms. So currently we've got 180,000 students in Zimbabwe and Malawi actively using these chatbots. And on low-tech, one of the good examples that we have is the use of radio and TV, which are the most common, especially radio is very common in rural Africa. And we've used radio in different ways. Firstly, through radio lessons. So UNESCO has partnered with ministries of education in various countries, including, for example, in Malawi and in Zimbabwe, to provide CSE lessons via radio. So the drivers for this initiative really was the need to reach all students while ensuring continuity during the COVID period. And another type of radio experience is the broadcasting of drama series. An example of a drama series is the Let's Talk drama series. So this is a 13-part radio drama series, which is in English, French, Portuguese, and Swahili, and it's aiming to reduce early and unintended pregnancies among adolescents and young people. The way that we rolled this out was by training 300 journalists in 12 countries on CSE and also on the content of the radio drama so that they can air the drama and host discussions on their radio stations. And this drama series has been aired in Malawi, in Kenya, in Tanzania, in Zimbabwe, and other countries, reaching over 40 million listeners in East and Southern Africa. Then one of, I would call it one of the high-tech innovations that we have is mobile applications for young people. So we've developed some mobile apps in Kenya, in Namibia, in Zambia, in Zimbabwe, and in Uganda, which provide students in universities with information on sexual and reproductive health, the location and contacts of nearby services, and free access to professional counseling. So it's one of the high-tech innovations in the sense that to access some of these services, you need to be online. For example, we've got student counselors that are available to provide counseling to the students via the mobile application. There is a panic button as well that students can use when they are in situations of distress and want to alert other students. And of course, location-based help services, which would use the mapping functions on the phone to help students locate SRHR services that are close to them. And some of the offline features of the mobile app include sexual and reproductive health articles, which students can read when they do not have the internet. So these are 3 examples of digital and low technology and low tech that we are using to reach young people directly. But I would like to invite you to scan the QR code on the screen. It will lead you to a handbook, which is a list of all the digital platforms and tools that we are using in the O3 program. Thank you so much. And this is the end of my presentation.
Thank you so much, Donald and Patricia, for your absolutely fascinating insight in the work that you're doing in Eastern and Southern Africa. Truly innovative and inspiring, making use of the circumstance, but also using innovative, smart ways to have an incredible reach. I mean, the ambition of your program reaching 70 million learners by 27 is truly remarkable. So chapeau to you both. And they might take a few more questions. I know we're almost run out of time, but it's good to, Sylvia, are there any responses from or questions from our audience? And otherwise, I'll ask the other panelists. Sylvia?
Yes. There's a question from David Ross. He says he's very impressed that the online CSA teacher training is complemented by the Connect and Learn community of practice and the mentoring and support program. And his question is, can you tell us what proportion of the teachers who have gone through the online training engage with the community of practice? And has the mentoring program worked in practice?
Donald or Patricia?
Thank you. First of all, this is linked to our learning management system. Once a teacher completes the CSE course for teachers, they're directly linked to the Connect and Learn platform. And what we have found through this platform is teachers are usually on and off the platform. But we have a core group of teachers who are actively participating in the community of practice.
Okay, thank you. Any other questions from the audience? Sylvia, otherwise we'll check with the other presenters. No, okay. There's actually a really lively and interesting conversations been going on, both at the chat and Q&A. So I want to thank the audience for your active involvement, and maybe DJ and Tao and Tigran, Ekaterina, you maybe want to give a short reflection or closing comment. DJ?
Yes, thank you very much, Rolf, and thank you for this very clear and concrete presentations. I think that what is really important is to build all these tools together with the people, and this is exactly what you did. And frankly, this is just why it's super successful. And the second thing is that, and thanks to you, Don, for sharing that. This is the question of, starting by the people and the means they have, and then high tech, tech, and low tech. This is the way in which we could reach the people, and this is also what IIT is doing. So for me, these two dimensions, doing it from the perspective of the people, the means they have on the one hand, and second, creating these tools with the people, would lead us to move from, adding new problems to the teachers and school staff to what we want. It means offering concrete solutions that help them to move forward in that complicated field of sex and relationship education. So thanks a million for all you're doing and for what you shared. Over to you, Ruf.
Okay, thank you, DJ. Tigran, would you like to give your reflection?
Well, the presentations made by our colleagues and ourselves underscores once again how challenging it is to prepare and motivate teachers, and therefore how we should think well while designing tools and training programs, so that within short period of time we equip them to deliver good quality lessons. Mission almost impossible, but still possible, and digital helps in this regard.
Yeah, and you do it. I mean, you're really advanced in doing this work on this very controversial topic in very complicated situations. Both the examples, I think, from your part of the world, Tigran and Ekaterina, and from Donald and Patricia. So really, really inspiring. Tao, would you like to also give a short reflection on the? Oh, you still have the sound issue. You do it with sign language. Okay, thank you. Ekaterina, did you want to have a final say?
Well, thank you so much. And I just want to thank our esteemed speakers, you who thank you so much for this wonderful moderation of this amazing webinar. And thank you for the participants for engaging in this vital dialogue. Let's continue to harness this transformative potential of digital tools in advancing health, informal health and well-being education, and ensure that every student's, every child's right to a healthy and empowered future is ensured. Thank you.
Thank you. And I want to close with thanking Tigran and Yekaterina for taking the initiative for this second webinar in our series. Actually, there will be a web page dedicated on this particular webinar alongside with the first webinar we did on violence prevention, with the videos of the presentations, with the different links to the presentations and the PowerPoints and all relevant information, including the wonderful QR that we all received from Don with your QR code to the O2 digital platforms and tools handbook. Certainly something to look further into. So I want to thank all the panelists. I want to thank the audience. I want to thank Sylvia for the technical assistance, and wishing you a good day.